Well, good morning. This is Dr. T here at Arizona Facial Plastics. We're about to do a second Vivace treatment on a patient today, and I wanted to take you through all of her photos from the first treatment that we did, and then move right into the room as Stacy is doing her second treatment. So here we go. Okay, so we have a 48-year-old female, and you can look at the dates here. Her first treatment was on the 18th. And we are now here on the 30th. So basically, this is the Vivace after one Vivace treatment. She was in the 82nd percentile for wrinkles. Now she's in the 87th percentile. She has beautiful skin. But as I kind of hold the camera back, we're going to go through some of the photos here. You can see improvement in the texture. The pores. So the way we can tell that is you see all the blue dots here. These are all the pores that she had before, and now they're much, much fewer and far between. Okay. And then again, the texture of her skin, and you can see all of the textural considerations, and now so much smoother. So she's gotten a nice improvement just in 12 days with the Vivace. Now let's go and look at the M3. Now with the M3, it's much more dramatic. This is her before, and you can see this area here. And now when we look at her today, she is much, much tighter right through here. We can look at the eyes. You see more wrinkling, and in fact, you see a little bit of a concavity here. After one treatment, much flatter and much tighter. Then as we come around to the other side, similarly, this is her before here, and the after, and again you can see pretty good improvement in the tightness of her neck. And I'm going to bring this in just a little bit so you see some improvement in the neck. So this was the before, and you can just see a little bit there, and now when you look at the after, it's a little bit tighter. This is after one treatment. So again, I'm trying to move the camera back here so you can see both of them as I rotate her head around. So again, you can see that improvement there to there. This is just after 12 days. So now we're going to go and we're going to watch her second treatment in the room here. And
Hi,
here is our wonderful patient.
Hi, everybody. Hi.
Hello, and Stacy's doing the treatment here. So we are just starting on the forehead. And as you can see, we have the settings on the system. So we're doing a level 5, 1400 microns, 500, and today we're using the blue light. And is this a guarded or unguarded today?
Guarded.
So we're using an insulated needle. Now Stacy did a beautiful job with the numbing cream, so she's very comfortable. On a scale of 1 to 10, how would you explain the discomfort today?
0.
0, okay.
And we're switching to the red when we get to the lower face.
And we're going to switch to the red when we get to the lower. What's beautiful about what Stacy does, if you don't mind me grabbing, is she uses the VersaPro base that we have with the numbing cream, and she will brush it on the patient. And these brushes, I think, really make a big difference in the dispersion of the numbing cream. So she did a beautiful job with that. Excuse me.
Anybody have questions out there?
We're not doing it live, we're actually recording. I'm going to post this on Instagram today.
Oh, good.
This is part of what our wonderful friend Dr. Nazarian taught me about Instagram. So we're going to go.
So you'll be able to edit?
We can edit this, and I'm going to put a watermark on it. She taught me how to do watermarks, and then so it's going to be beautiful.
So you switched to a red laser, a red light.
Yeah, so she did the blue light on the forehead. Tell us why, Stacy. Tell us why that was your
Because
strategy today.
Because when I was looking at her, there was a little bit of congestion, and so I didn't want her to have a breakout.
Okay. And so the blue light is good for kind of for acne. And one of the things we didn't show on the camera was her porphyrin score went down a little bit. Just a little. She didn't have a breakout, but I do agree on the second treatment. Maybe a blue light occasionally is good. Her jawline to jawline looked amazing though on the camera. She tightened up nicely.
Her skin looks very refined. It looked great before her first treatment, but it has even more refinement today.
Awesome.
Smooth texture.
So what you're seeing here is the beauty of the robotic motor. You know, that nice sort of calming sound is really the robot just kind of doing its thing. And one of the beautiful things about the nose was the pore shrinkage. She has no pores that were identified on the Vivace on her nose. So beautiful job on the pore reduction from the last treatment, Stacy. Now, whenever I do an Instagram, all I can think of is I hope Dr. Nazarian approves of our work, because her posts are so amazing with her Vivace that I'm now sort of like I have my ideal Instagram. So now I have to like measure up.
What is the Instagram? I gotta pull it up.
She has, you know, her posts are just beautiful. The way she presents and talks about things, and she's very personable. So.
Me too.
Do you know who is, so Gabriel's Angels has a girl named Blair who does pet therapy training, and she's also doing her social media. And have her give me a lesson.
Yeah, Instagram's going to knock Facebook clear out soon enough as far as more marketing. People will tend to use Facebook on personal things, but Instagram's starting to really take that lead on promo and actual marketing pieces.
Yeah.
Well, you heard it from the experts here. I learned that this weekend from our course in LA. Stacey, what's your after strategy with the procedure today? What are you going to be putting on her skin?
We're going to be using the Vivace Experience Kit. So we will be spraying the Soothe Recovery Spray first. And then after this Soothe Recovery Spray, we're going to put the Boost.
Okay.
We'll let the Boost penetrate into the skin. And then after that has penetrated, another quick little spray to soothe her skin. And then we will put the soothing balm on her skin to create that protective barrier.
Got you.
And then she will be on her way. She's going to spend the rest of the day at home out of the sun.
Good.
To protect her skin.
And it is a sunny day today. It's so beautiful.
And then she will use that product tomorrow.
Okay.
And then possibly even the next day if her skin is showing any signs of redness or tightness.
Okay, beautiful.
Incidentally, the mask was lovely that you gave last time.
Oh, the mask. You love the recovery mask. Good.
Very soothing.
Yeah. We have a mask here I could show them. Do you have a mask here?
I do.
There's one behind you. If you want to grab it, I'll put it on the film here.
There is a mask that is in. Do you mind passing one of those kits over here?
Got one that's open.
I can just open it up.
Oh yeah, so here's the recovery kit. Oh, thank you. So these are the Vivace recovery kits. I love those. And right in the back with the picture of our model, you can see the mask. And that's the mask that they put on.
I also want to say in that recovery kit is also a cleanser. The cleanser is critical because a lot of times people will have a cleanser with a salicylic acid or a glycolic.
Right.
And if they use that type of a cleanser immediately following the treatment, within 24 to 48 hours, you can actually have a chemical burned to the skin.
Oh, wow.
So using our Aftercare kit is critical for being able to determine and predictability for the outcome.
And if I can put my 2 cents in on
Yes.
the Aftercare kit,
Yes.
as someone who travels professionally all over the country to perform on different stages, all of it is actually in the right amount, not to need to be checked in, but to go on carry-on. All of it is in just the right travel size. So for me, that's ideal.
So when you need a travel kit for travel, call me and I'll set you up.
Awesome. Awesome. Are these not travel friendly?
They
are.
They
100%.
are? Oh,
It's
yeah. I was going
immediate.
to say, yeah.
They're just the right ounces, they're just
Cool.
the right size, and I don't check bags because I can be in 6 cities in 6 days.
Right.
So, for example, we'll most likely have it with me. I'll leave for Houston in 2 days. So
Super Bowl.
those products will go with
Super
me.
Bowl. Are you going to the Super Bowl?
I actually do an event at the Super Bowl every year.
Oh, really?
It's my 8th time.
Oh my gosh.
That's awesome.
Sweet. Everyone's going to Houston this week for the
Yeah.
big game. Nice. Well, see, I didn't know we had put enough. I mean, that was one chalk went up to our team. I never even thought about travel.
It's perfect.
So when people ask you, wow, your skin looks amazing this week, you'd be,
My answer always is. In fact, I blogged last time about my entire experience from the moment I walked in the front door to what it was like 1 hour post, to what it was like 2 hours post, the morning after, the evening of. Had a tremendous amount of response of messages and questions. An easy access to that is the vivaceexperience.com because it answers a lot of the questions. I also feel that it's not just the equipment, but the individual actually applying it. Stacey's excellent at what she does,
Thank you.
but I will do the same tonight.
Yeah, it is. The operator is important, and I think from the trainings and stuff we've done, Stacey has really distinguished herself as one of the leading voices on the Vivace. She really gets it so well. So
Thank you.
that's really cool. I do think that there's a limit on the amount of minutes you can post on Instagram. I think is there like Snapchat is like,
yeah, you can just do.
but Instagram is like,
And Facebook Live is unlimited,
right,
but Instagram they have like a 60-second.
right.
But you can also break them down into a couple different posts.
Yeah.
So different
So
phases
that's what we're
of-
gonna. So I'm gonna post this on Facebook Live, and then I'll cut the first portion of it for the Instagram post.
Okay,
Because
so
Dr. Nazarian showed me how to download Video Show, which can edit your videos right on your phone. I got
nice.
I got a snap course in that.
Nice. Okay,
So-
second pass.
Because in the end, you're only as good as the people who teach you.
So the second pass is deeper now.
I'm going, so it's at 1.4, now I'm going 1.7 on the forehead,
Okay.
and then I'm going to do about 2.7 on the cheeks and lower face.
Okay.
So I'm going to treat the, actually the forehead, the periorbital area, and then I'll drop down to the neck, and then I'll come back, and I'm also going to increase the heat and the RF on the cheeks and chin area.
Do you find that people are on their first treatment, they don't go hot enough or deep enough just because they're not certain at how their skin is going to react? Or what is the, how do you determine what depth and what temperature?
So what I do is, depending on the skin type, so if somebody has soft, delicate skin that, like Letitia's got pretty delicate skin, and so I'll go a little bit more moderate setting. Also, if someone has really dark skin tones, I'll be a little bit more moderate. But really, as far as the depth, I want to make sure on the forehead that I'm not just hitting bone. So I want to make sure I'm actually going into the tissue and delivering the heat into the tissue. And then the cheeks, I will go a little bit deeper on somebody who's got thicker skin. So if somebody's got really thick, oily skin, I'll go maybe even 3.5, really depending. And also if I feel like I'm trying to get through some fat to get into the deeper tissues. And then really I think key is to always do 2 passes working at different levels. So creating the heat in 2 different planes of the tissue. Unless I go with the unguarded needle, then I'm creating heat all the way through the needle. And so then I'll probably only do 1 pass. I'll change my overlap just a little bit. But the beauty with this is when you're comfortable with the technology is tailoring the treatment to each person and not do cookie cutter treatments.
And that's where, as Letitia said, having the skilled technician working the machine.
Mm-hmm.
And I've been fortunate enough to work with Dr. Tahizadeh, who's taught me a lot of new techniques and different thought processes than what I was exposed to in the past.
And Stacey's been great. She's really taken to the machine, and we have just in general, like there are physicians who purchased the Vivace, who like literally they have put a lot of machines aside because the machine is so versatile. We have one physician who called me, and he's like, my estheticians are fighting over it. I got to buy it. I mean, after he's like, the financing isn't done on the first one. He has to buy a second one because he has 10 employees, and they all want the machine. All their clients on the machine. He doesn't know what to do because it's very intuitive. What she's doing with making these little channels is so intuitive to how the skin recovers. So yeah, it's like aerating your lawn. It's like how you get. I mean, really, it's the same process. I mean, there's so much similarity in the principles of making channels in skin to bring in the opportunity for the collagen induction. And so forth.
There's also the opportunity, if we wanted to use PRP, we could use PRP.
The rich plasma.
Mhm. So that's another option.
So you just draw that from the patient they're sitting here, and then
And we have a new spinner we just finished. So
The other thing about this too, compared to some of the other microneedling devices, is the channels don't stay open for very long, maybe 2 to 3 minutes. And so you'll notice that they will put product on the skin and then drive the product in with the needles. Here we're opening the skin and then we apply the product because our channels stay open for 4 to 6 hours. Dr. T can talk more about that.
that's perfect. That's all you need to say right there. Huge difference between.
well, because you saw the video of the other machine, one of the competing machines. It snaps on the skin, and it literally tears the skin because it's so aggressive. And technology improves. Micromotors, robotic motors. It just gets better and better.
So what's the difference treatment for men versus women? I mean, men have got beards and shave. There's no issue with the
No, in LA this weekend, we did a guy in this demo they were doing, and did fine.
He had a beard.
Yeah, I mean, not
Scruffle?
like just scruffle. He didn't have. You can't go through hair. But
Yeah.
he just had
Yeah,
like
it's
the.
deeper.
He had
So
like
shave and then have the procedure.
what do you call it?
And the
5
thing-
o'clock shadow.
What men absolutely love about this treatment is they don't like all their buddies to know that they're doing something. And so they can come in, go home, have some pizza, watch football, and then get up the next morning and they're back to normal and their friends aren't going to give them a hard time. So,
Yeah, this year at the Oscars, I think she was saying that hopefully we'll get 1 or 2 actresses coming in for Vivaces before the Oscars. It's always a positive thing. So hopefully we'll get some.
I treated somebody who was she was chairing a major event in Phoenix, one of the biggest events in our city, and she had the treatment done the day before the event, and her skin looked amazing that night. So it just kind of goes to show that people aren't afraid to do this before big events. My favorite day personally for my skin is day 3 after the treatment. Looks amazing.
Can this take the place of Botox for some type of patient?
Someone asked me, I've actually done that. You can actually,
On your neck.
though it's totally off-label to do this, but you can put things into the channels and it works. So
Can I tell you what I've done? So I've been doing this kind of stuff for about almost 20 years. And so I used to get full correction of my forehead with Botox. Now, when I'm stimulating the collagen with this type of a treatment, it gives me a little bit of a brow lift and it softens the hooding around my eyes. So now what I do is I use this type of technology to get a little bit of correction and then fine tune with the Botox. And same with the fillers. Then I'm not having that
using as
overdone.
much, yeah.
I don't have that overdone look.
Gotcha.
So I've got a much more natural appearance
So
than what I
like
used
these
to
right
have.
here,
Right.
smile lines.
So it's called micro injection, and actually I met a lady another person in LA, and that's what she's doing with microneedling is they microneedle and they just trickle some Botox in, and they get this nice sort of micro effect.
Mm.
And I know people are working on, actually making creams out of Botox, so it would be like a daily thing. But yeah, the channels here, I mean, again, it's totally off-label if people sit there and, put Botox on the skin topically after this, but this lady was doing it, and she seemingly indicated with different microneedling she's gotten results.
Mm-hmm.
I don't know. Obviously, for the cost of these neurotoxins, you definitely want to, unless someone has money to burn, you want to inject it, and just
Yeah, I
putting
mean,
it
inject
on.
is proven. So.
But yeah, if people want sort of a micro droplet effect, I guess you could, who knows. But it's definitely a beautiful, beautiful treatment she's doing here. I mean, just the neck is just beautifully just kind of coming out.
Okay, so I'm going to make the adjustments for the mid-face. I'm going to go up to 2.6. I'm going to increase the level to 6. And our let me know if it's too much. Okay.
Mm-hmm.
And Cece you're using the push button.
There's an automatic fire mode on this, yeah.
And you've got the foot pedal
Or the hand piece,
either
yeah.
or, and it,
Yeah. If she holds the button down, so you wear 2600 microns now, so she's going a little bit deeper. If you hold the button down, it'll automatically fire at the intervals.
mm-hmm.
But I do it like she does. I like to hit it each time I do it.
It's
I'm just
also
used to that.
faster. There's less pause when you do it yourself.
Yeah, there's less of a pause.
So I can get through the treatment just a little bit faster. It's not controlling the behavior. I have to push the button. This is gonna
Yeah, I'm always used to that with lasers. You always hit the button once and it fires. And the camera, you really, on the before photos, you take your thumb down just a little bit there, Stacey. Yeah, I mean, you can see that area that you see right there is, if we go to the camera here, let's go back to the camera system. That was this area right there. And you can see just a real improvement from what I just showed you. From here to here. You can see there just marked improvement all the way through that area, just from that one treatment. And then obviously we're getting a little bit of swelling here, but it's great.
Your kit came with one mask, is that correct? Okay. I'm going to send you with another one because today's treatment's a little bit more aggressive. So direction it before you go. I think we're going to do PRP on Dr. T today.
Me?
His head. Want to do hair restoration?
Oh, the hair restoration? Yeah, we could do that. Oh, with the Omni products, yeah. We probably should do that.
Is your restroom on this floor?
Right there. Beautiful job. So who's going to win the Super Bowl? Predictions?
Patriots! Go
Patriots.
Patriots! Tom Brady fan.
Okay.
I'm allowed to say that now.
Yeah, I mean it's
Now that Steelers are out.
yeah, the Steelers they weren't at their best form in that game. They had a good season. In the end, it's all about having a good season, feeling good about what you accomplished, and then going on to the next year.
Last one. Good job. Awesome, Felicia.
Okay, so on the for the people out there, yes, you on a scale of 1 to 10, more of a 3 when you do hit a higher heat or whatnot area. However, as someone that has in the past done photofacials or other skin tightening treatments, that level of pain can run at a 12.
Yeah.
It is a far less painful or invasive. It's just a more of a wear feeling than it is a
Right.
discomfort.
Okay.
I will say the numbing treatment is really does work. I will tell you the second it's finished, there is zero pain or any discomfort. It's only at the moment, and it's really kind of just like a soft, almost little touch of a bee or something along those lines. But compared to other treatments, night and day. Night and day.
I'm going to spray some sprays.
Okay,
Close your
yes,
eyes
ma'am.
for 1 second. Here we go.
Beautiful.
And again, only when you're really told that you're going to go that higher level, that your skin is ready, and you're going to
Right.
go into a more penetrative mode with the machine. Of course, that's expected, but it still is at little to light to moderate, if anything.
I mean, the fact that you're describing this, we were at 2600 microns. I was just showing the viewers the setting here at 2.6. It's pretty incredible that you can go that deep into the skin and just have somebody smiling at you the whole time. I never thought I'd see that day. I mean, honestly, I've done a lot of lasers, and
Oh yeah.
you know, you have to do what
I
you
would
do.
white knuckle it through my
Yeah.
photofacials, through the high jewels.
So this is the Boost Glide serum. It's just a nice after product for recovery. We're just going to put that on there. We'll just get her to sit up, and we'll show the viewer